Phlebotomy Certification Exam Blood Tubes and Additives. Question 1. After reviewing the order, which tube is most appropriate for a routine CBC? Option A, lavender top tube containing EDTA. Option B, gray sodium fluoride tube. Option C, red no additive tube. Option D, light blue sodium citrate tube. The correct answer is option A, lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Citrate is used mainly for coagulation testing. Question 2. When preparing for collection, which additive is found in a light blue tube used for patient NHACPT testing? Option A, sodium fluoride with potassium oxalate. Option B, sodium citrate. Option C, lithium heparin. Option D, EDTA. The correct answer is option B, sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. EDTA is used mainly for hematology and can interfere with coagulation testing. Question 3. In a routine phlebotomy scenario, which tube is commonly selected for many serum chemistry tests when gel separation is desired? Option A, light blue citrate tube. Option B, gray fluoride tube only. Option C, serum separator tube with clot activator and gel. Option D, lavender EDTA tube. The correct answer is option C, serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. EDTA plasma is not serum and can interfere with some chemistry tests. Question 4. Before proceeding with the draw, which tube is commonly associated with heparinized plasma chemistry testing? Option A, light blue top tube. Option B, pink top tube. Option C, lavender top tube. Option D, green top tube. The correct answer is option D, green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Lavender tubes contain EDTA for hematology. Question 5. During a skills check, which tube is most commonly used for glucose preservation when testing may be delayed? Option A, gray top tube with sodium fluoride and an anticoagulant. Option B, light blue citrate tube. Option C, blood culture bottle. Option D, plain red tube only. The correct answer is option A, gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. A plain red tube does not contain glycolysis inhibitor. Question 6. In the blood collection station, which tube is commonly used for blood bank testing such as type and screen? Option A, light blue citrate tube. Option B, pink top EDTA tube. Option C, green heparin tube for every blood bank test. Option D, gray top fluoride tube. The correct answer is option B, pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Gray tubes are associated with glucose or lactate preservation. Question 7. For a therapeutic drug level collection, which tube is generally collected for a blood culture specimen? Option A, gray fluoride tube. Option B, SST after clotting. Option C, sterile blood culture bottle or SBS containing culture tube according to policy. Option D, lavender EDTA tube only. The correct answer is option C. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. A lavender tube is not designed as the primary blood culture container. Question 8. Why must a light blue citrate tube be filled to the proper level in the hospital unit during morning rounds during a competency review? Option A, EDTA needs extra room to mix. Option B, serum cannot clot unless the tube is full. Option C. The tube color changes if underfilled. Option D. The blood to anticoagulant ratio must be correct for coagulation results. The correct answer is option D. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Tube color does not change to warn of underfilling. Question 9. After collecting an additive tube, how should it usually be mixed in the urgent care laboratory during a final review? Option A, gently invert the tube the recommended number of times. Option B, leave it unmixed until centrifugation. Option C, open the stopper and stir with a wooden applicator. Option D, shake it hard until bubbles appear. The correct answer is option A. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Vigorous shaking can cause hemolysis. Question 10. When preparing for collection, which problem can occur if a lavender EDTA tube is not mixed soon after filling? Option A. The specimen turns into serum. Option B, microclots may form and make hematology results unreliable. Option C. The sodium citrate ratio improves. Option D. The tube becomes sterile for culture. The correct answer is option B. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Mixing does not create sterility for culture testing. Question 11. In a routine phlebotomy scenario, which additive can falsely increase potassium if carried into a chemistry tube? Option A, sodium fluoride without potassium. Option B, sterile culture broth only. Option C, potassium EDTA. Option D, clot activator gel only. The correct answer is option C. Potassium EDTA. Potassium EDTA carryover can contaminate chemistry specimens and falsely elevate potassium while lowering calcium. Sodium fluoride is associated with glucose preservation, not potassium EDTA effects. Culture broth is used for organism recovery and is not the classic potassium carryover problem. Gel itself does not add potassium in the same way EDTA contamination does. Question 12. Before proceeding with the draw, which tube is most associated with ESR testing in many phlebotomy settings? Option A, gray fluoride tube for every ESR. Option B, SST for all ESR methods. Option C, blood culture bottle only. Option D, lavender EDTA tube or designated black citrate tube depending on method. The correct answer is option D. lavender EDTA tube or designated black citrate tube depending on method. ESR collection depends on the facility method, commonly EDTA or a designated citrate ESR tube. Gray fluoride tubes are not the usual universal ESR container. SST serum is not appropriate for all ESR methods because ESR evaluates cellular settling. Blood culture bottles are for microbiology cultures. Question 13. During a review, which tube additive prevents glycolysis after collection? Option A, sodium fluoride. Option B, EDTA for morphology only. Option C, SBS for blood cultures only. Option D, silica clot activator only. The correct answer is option A. Sodium fluoride. Sodium fluoride inhibits glycolysis, helping stabilize glucose in the specimen. EDTA preserves cells but is not the classic glycolysis inhibitor. SBS is used in blood culture collection and is not the routine glucose preservative. A clot activator promotes clotting rather than inhibiting glycolysis. Question 14. How long should a tourniquet generally remain in place before it risks hemoconcentration in the physician office lab during a mock exam? Option A. Until all labels are printed. Option B. No longer than about 1 minute. Option C. Only after the patient pumps the fist repeatedly. Option D. At least 5 minutes for every draw. The correct answer is option B. No longer than about 1 minute. Tourniquet application beyond about 1 minute can concentrate blood components and alter some results. Administrative delays do not justify prolonged tourniquet use. Repeated fist pumping can also contribute to hemoconcentration. 5 minutes is excessive and can distort laboratory values. Question 15. When should the tourniquet be released during routine tube collection in the community health screening event during a skills check? Option A. Before the needle ever enters the skin in every case. Option B. After 5 minutes to improve the specimen. Option C. As soon as blood flow is established and before removing the needle, following policy. Option D. Only after the patient leaves. The correct answer is option C. As soon as blood flow is established and before removing the needle, following policy. Releasing the tourniquet once blood flow is established helps reduce hemoconcentration and patient discomfort. Removing it before needle entry in every case may make vein access difficult. Prolonged application does not improve specimen quality. Leaving it on until the patient leaves is unsafe and unnecessary. Question 16. Why should patients avoid repeatedly pumping the fist during venipuncture in the preoperative testing area during a practice drill? Option A. It prevents all hematomas. Option B. It guarantees faster clotting in citrate tubes. Option C. It sterilizes the collection site. Option D. It may alter analytes such as potassium through hemoconcentration and muscle activity. The correct answer is option D. It may alter analytes such as potassium through hemoconcentration and muscle activity. Repeated fist pumping can change blood composition and affect certain test results. Hematoma prevention depends on technique and post-draw pressure, not fist pumping. Citrate tubes are anticoagulated and do not rely on patient fist motion. Fist pumping has no antiseptic effect on the skin. Question 17. After reviewing the order, which needle gauge is commonly used for routine adult venipuncture with evacuated tubes in the Oncology Infusion Center during a scenario? Option A, 21 or 22 gauge needle. Option B, 30 gauge needle for all adults. Option C. A lancet designed for heel stick only. Option D, 12 gauge needle. The correct answer is option A. 21 or 22 gauge needle. A 21 or 22 gauge needle usually provides adequate flow while limiting trauma for routine adult veins. A 30 gauge needle is too small for standard evacuated tube collection and may slow flow. A heel stick lancet is not used for routine venipuncture. A 12-gauge needle is unnecessarily large and traumatic for routine phlebotomy. Question 18. For a patient with a small fragile hand vein, which device may improve control in the dialysis-adjacent clinic during a competency review? Option A, heel puncture lancet. Option B, winged infusion set with appropriate tube or syringe technique. Option C, unprotected straight needle used without a holder. Option D, large bore blood donation needle. The correct answer is option B. Winged infusion set with appropriate tube or syringe technique. A winged infusion set offers better control for small or fragile veins when used according to policy. A heel puncture lancet is for dermal puncture, not accessing a hand vein. Using an unprotected straight needle without a holder is unsafe and not standard practice. A large bore donation needle is excessive and can injure a small vein. Question 19. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first in the student skills lab during a final review? Option A. The discard tube removes EDTA carryover from the skin. Option B. The discard tube replaces patient identification. Option C. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Option D. The discard tube warms the patient's arm. The correct answer is option C. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. EDTA carryover is managed by order of draw, not by removing it from the skin. No tube can replace proper patient identification. A discard tube is not used to warm the arm. Question 20. If no blood enters the tube after needle insertion, which action is safest first in the occupational health clinic during a study session? Option A, turn the needle in circles under the skin. Option B, leave the needle in place while searching for another vein. Option C, probe deeply until blood appears. Option D, gently adjust needle position while staying within policy and patient comfort limits. The correct answer is option D. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. Rotating the needle under the skin is traumatic and not appropriate. A needle should not be left in one site while searching elsewhere. Deep probing increases pain, hematoma risk, and nerve injury risk. Question 21. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do in the blood collection station during a structured exam prep drill? Option A, stop the draw, remove the needle safely, and follow facility procedure. Option B, ask the patient to ignore it until the tube fills. Option C, release pressure only after all tubes are collected. Option D, advance deeper to pass the nerve. The correct answer is option A. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Ignoring the symptom places the patient at unnecessary risk. Continuing tube collection delays the response to a possible complication. Advancing deeper can worsen nerve injury. Question 22. During a difficult draw, why should excessive probing be avoided in the outpatient clinic during a clinical simulation? Option A. It sterilizes the vein. Option B. It increases pain, hematoma risk, and possible nerve or tissue injury. Option C. It prevents the need for patient identification. Option D. It improves all specimen results. The correct answer is option B. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Needle movement has no sterilizing effect. Patient identification is always required regardless of draw difficulty. Probing does not improve laboratory accuracy. Question 23. If a vein collapses during evacuated tube collection, which change may help on a redraw in the hospital unit during morning rounds during a review? Option A. Keep the tourniquet on for several minutes. Option B. Tell the patient to pump the fist continuously. Option C. Use a smaller tube, syringe, or winged set according to policy. Option D. Use a stronger vacuum tube on the same fragile vein. The correct answer is option C. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. Prolonged tourniquet time can alter results and increase discomfort. Continuous fist pumping may affect analytes and does not solve vein collapse. A stronger vacuum can worsen collapse. Question 24. To protect patient safety, which site should generally be avoided unless specifically approved by policy or provider order in the urgent care laboratory during a mock exam? Option A. An acceptable dorsal hand vein. Option B. A suitable cephalic vein. Option C. A well-palpated median cubital vein. Option D. A foot or ankle vein. The correct answer is option D. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. A dorsal hand vein may be acceptable when antecubital veins are unavailable. The cephalic vein can be appropriate when assessed carefully. The median cubital vein is a common routine site when suitable. Question 25. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture in the pediatric clinic during a skills check? Option A. The fistula must be protected from injury, infection, and altered blood flow. Option B. All tubes drawn from that arm turn blue. Option C. It eliminates the need for a tourniquet. Option D. The blood in that arm has no cells. The correct answer is option A. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Tube color is determined by the collection container, not the arm. Tourniquet decisions do not remove the risk to a fistula. Blood in the arm still contains cells. Question 26. Why is the site of a prior mastectomy often avoided for venipuncture in the long-term care unit during a practice drill? Option A. The skin cannot be cleaned. Option B. Lymphatic changes can increase risk for swelling, infection, or complications. Option C. All specimens from that side clot immediately. Option D. The veins always contain arterial blood. The correct answer is option B. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. The issue is not an inability to cleanse skin. Specimens do not automatically clot because of collection side. Venous blood does not become arterial because of mastectomy history. Question 27. When N4 is running in one arm, which collection choice is usually preferred in the mobile collection site during a scenario? Option A. Collect directly through the 4 tubing without authorization. Option B. Ignore the 4 because additives prevent contamination. Option C. Use the opposite arm when available and follow facility policy. Option D. Draw above the 4 site while fluid is running. The correct answer is option C. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from 4 fluids. Line draws require authorization and specific procedure. Tube additives do not correct 4 fluid contamination. Drawing above a running 4 can contaminate or dilute the specimen. Question 28. Before proceeding with the draw, which finding makes a venipuncture site a poor choice in the emergency department bay during a competency review? Option A. Clean intact skin over an antecubital vein. Option B. A site that allows safe patient positioning. Option C. A vein that is palpable and resilient. Option D. Edema, burns, scarring, or signs of infection at the site. The correct answer is option D. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. Clean intact skin supports safe site preparation. Safe positioning is desirable for venipuncture. A palpable resilient vein is generally a favorable finding. Question 29. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect in the physician office lab during a final review? Option A. Hematoma formation. Option B. Successful fasting status. Option C. Normal clot retraction in the vein. Option D. Proper tube mixing. The correct answer is option A. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Fasting status cannot be determined by puncture site swelling. Clot retraction is a laboratory process, not a normal event around an active needle site. Tube mixing happens after collection and does not cause local swelling. Question 30. If a hematoma starts to develop during venipuncture, which action is appropriate in the community health screening event during a study session? Option A. Massage the swollen area vigorously. Option B. Release the tourniquet, remove the needle, and apply pressure. Option C. Ask the patient to bend the elbow tightly. Option D. Continue filling all ordered tubes. The correct answer is option B. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Vigorous massage can worsen bruising and tissue injury. Bending the elbow can increase bruising and does not provide focused pressure. Continuing the draw can enlarge the hematoma. Question 31. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the preoperative testing area during a structured exam prep drill? Option A. Leave the needle in while getting more tubes. Option B. Give the patient food before removing the needle. Option C. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option D. Ask the patient to stand up and walk it off. The correct answer is option C. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Standing can lead to a fall. Question 32. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the oncology infusion center during a clinical simulation? Option A. Ask the patient to bend the elbow sharply. Option B. Use the same bandage time for every patient without checking. Option C. Skip pressure to avoid bruising. Option D. Apply firm pressure longer and verify bleeding has stopped before bandaging. The correct answer is option D. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Skipping pressure increases bleeding risk. Question 33. After reviewing the order, which action helps prevent a hematoma after removing the needle in the dialysis adjacent clinic during a review? Option A. Apply clean gauze with firm pressure while the arm remains straight. Option B. Rub the puncture site to spread the blood. Option C. Remove the needle before releasing the tourniquet every time. Option D. Have the patient bend the elbow tightly. The correct answer is option A. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Bending the elbow may increase leakage into tissue. Question 34. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the student skills lab during a mock exam? Option A, tube additive carryover. Option B, possible arterial puncture. Option C, normal capillary refill. Option D, proper venous flow. The correct answer is option B. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Typical venous flow is darker and not pulsatile. Question 35. In a routine phlebotomy scenario, which tube is collected first when blood cultures are ordered with other venipuncture tubes in the occupational health clinic during a skills check? Option A, gray fluoride tube. Option B, serum separator tube. Option C, blood culture bottles or sterile culture tube. Option D, lavender EDTA tube. The correct answer is option C. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. EDTA tubes are collected later to prevent additive carryover. Question 36. In the standard venipuncture order of draw, which tube usually follows blood cultures in the blood collection station during a practice drill? Option A, gray fluoride tube. Option B, royal blue tube for every test. Option C, lavender EDTA tube. Option D, light blue sodium citrate tube. The correct answer is option D. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. EDTA is collected later because it can interfere with coagulation and chemistry tests. Question 37. During a scenario, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes in the outpatient clinic during a scenario? Option A, blood cultures, light blue, serum, green, lavender, gray. Option B, gray, lavender, green, serum, light blue, blood cultures. Option C, serum, lavender, blood cultures, gray, light blue, green. Option D, lavender, gray, green, serum, light blue, blood cultures. The correct answer is option A. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Starting with lavender risks EDTA contamination of later tubes. Question 38. Why does order of draw matter during evacuated tube collection in the hospital unit during morning rounds during a competency review? Option A. It eliminates the need to mix tubes. Option B. It helps prevent additive carryover from altering later specimens. Option C. It determines the patient's fasting status. Option D. It makes patient identification optional. The correct answer is option B. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Patient identification is required regardless of tube order. Question 39. During capillary puncture, which specimen type is generally collected first when ordered in the urgent care laboratory during a final review? Option A, gray top microtube. Option B, non-additive tube after all others. Option C, blood gas specimen. Option D, serum specimen. The correct answer is option C, blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Serum is not first when blood gases are ordered. Question 40. To protect patient safety, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the pediatric clinic during a study session? Option A, gray microtube first even when blood gases are needed. Option B, any order because capillary tubes have no additives. Option C, serum microtube before EDTA for every draw. Option D, EDTA microtube before other additive and serum microtubes. The correct answer is option D, EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Blood gases are more time-sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Serum first collection can allow clotting before the EDTA specimen is filled. Question 41. After reviewing the order, which practice helps reduce hemolysis during a routine CBC collection? Option A, use appropriate needle size and gently invert tubes instead of shaking them. Option B, shake additive tubes vigorously. Option C, pull back a syringe plunger as hard as possible. Option D, force blood rapidly through a small needle. The correct answer is option A. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Forcing blood through a small needle can damage cells. Question 42. When preparing for collection, which laboratory result is especially affected by hemolysis because red cells release intracellular contents in the mobile collection site during a clinical simulation? Option A, tube expiration date is extended. Option B, potassium may be falsely increased. Option C, tourniquet pressure becomes lower. Option D, patient date of birth becomes invalid. The correct answer is option B. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Patient demographics are not changed by cell rupture. Question 43. When using a syringe for blood transfer, which method best protects specimen quality in the emergency department bay during a review? Option A, squirt blood through the needle into each tube. Option B, shake each tube hard to remove clots. Option C, use a safety transfer device and allow blood to flow gently into tubes. Option D, remove the tube stopper and push blood in forcefully. The correct answer is option C. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Removing stoppers increases exposure and contamination risk. Question 44. Why should alcohol be allowed to dry before puncture in the physician office lab during a mock exam? Option A, wet alcohol improves vein anchoring. Option B, alcohol drying replaces tourniquet use. Option C, dry alcohol makes the tube additive stronger. Option D, wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. The correct answer is option D. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Drying does not change the chemical strength of tube additives. Question 45. During a skills check, which specimen often requires protection from light after collection in the community health screening event during a skills check? Option A, bilirubin specimen. Option B, routine sodium citrate coagulation tube. Option C, blood culture bottle during incubation. Option D, CBC specimen for platelet count. The correct answer is option A. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Question 46. In the preoperative testing area, which specimen commonly requires rapid transport on ice or chilled handling according to policy? Option A, serum separator tube for a lipid panel after clotting only. Option B, ammonia specimen. Option C, blood culture bottle placed in the freezer. Option D, routine CBC kept for the next day. The correct answer is option B. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. A routine CBC should not simply be held for the next day without stability guidance. Question 47. For a lipid panel collection, which action best maintains specimen integrity during transport to the laboratory? Option A, centrifuge every tube immediately regardless of type. Option B, place all blood specimens in direct sunlight. Option C, follow required time, temperature, light, and handling instructions for the ordered test. Option D, store every specimen at room temperature overnight. The correct answer is option C. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Overnight room temperature storage can make many specimens unacceptable. Question 48. If a specimen must be transported cold, which approach is appropriate in the dialysis adjacent clinic during a competency review? Option A, hold it in a bare hand to keep it visible. Option B, place it near a heater until pickup. Option C, submerge the tube in loose ice water. Option D, place the specimen in the approved cooling method without direct water contamination. The correct answer is option D. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Loose ice water can damage labels and create contamination issues. Question 49. After reviewing the order, which situation is a common reason for specimen rejection in the student skills lab during a final review? Option A, wrong tube type or insufficient specimen volume. Option B, patient stated date of birth. Option C, tube was labeled at the bedside. Option D, collector wore gloves. The correct answer is option A. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Wearing gloves is expected when blood exposure is possible. Question 50. Why should tube expiration dates be checked before collection in the occupational health clinic during a study session? Option A. Expired tubes prevent hemolysis in every case. Option B. Expired tubes may have inadequate vacuum or unreliable additive performance. Option C. Expired tubes are required for coagulation testing. Option D. Expired tubes identify patients faster. The correct answer is option B. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Expiration dates do not help verify identity. Question 51. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the blood collection station during a structured exam prep drill? Option A. Tell the patient not to mention the meal. Option B. Cancel every test without notifying anyone. Option C. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Option D. Draw the specimen and write fasting on the label. The correct answer is option C. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Marking the specimen as fasting would be inaccurate documentation. Question 52. Why is fasting status important before some chemistry tests in the outpatient clinic during a clinical simulation? Option A. Fasting makes needles sterile. Option B. Fasting eliminates the need for tube mixing. Option C. Food changes the patient's legal name. Option D. Food intake can alter analytes such as glucose or lipids. The correct answer is option D. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Food intake does not affect patient identity. Question 53. For a medication trough level, when is the specimen usually collected in the hospital unit during morning rounds during a review? Option A. Immediately before the next scheduled dose. Option B. At any random time during the day. Option C. Only after the medication is discontinued for a week. Option D. Immediately after the medication is swallowed. The correct answer is option A. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Immediately after dosing reflects absorption or peak timing, not trough. Question 54. During a glucose tolerance test, why must collection times be followed carefully in the urgent care laboratory during a mock exam? Option A. Timing only matters after the last tube. Option B. Timed results show how the body responds to a measured glucose dose. Option C. The patient should eat between timed draws to stay comfortable. Option D. Any time is acceptable if the tubes are gray. The correct answer is option B. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Tube type does not remove the need for precise timing. Question 55. For a lactate collection, which documentation is especially important for a timed specimen? Option A. Only the patient's room number. Option B. A note saying collected sometime today. Option C. Exact collection time recorded on the label or requisition according to policy. Option D. The phlebotomist's favorite tube brand. The correct answer is option C. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Tube brand does not communicate timing. Question 56. Before collecting blood cultures, why is careful skin antisepsis critical in the long-term care unit during a practice drill? Option A. It eliminates the need for sterile bottles. Option B. It changes venous blood into arterial blood. Option C. It makes EDTA tubes clot faster. Option D. It reduces contamination that could cause a false positive culture. The correct answer is option D. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. EDTA clotting is unrelated to culture site preparation. Question 57. When collecting blood cultures with other tubes, which priority is most important in the mobile collection site during a scenario? Option A. Maintain sterility and collect cultures before non-sterile tubes. Option B. Touch the bottle tops after cleaning to confirm dryness. Option C. Use a non-sterile transfer cup. Option D. Collect cultures after gray tubes. The correct answer is option A. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Collecting cultures after other tubes increases contamination risk. Question 58. If using a winged set for blood cultures, why is bottle order guided by facility policy in the emergency department bay during a competency review? Option A. The order prevents the need to clean the site. Option B. Air in the tubing can affect which bottle should be filled first. Option C. The order makes the needle reusable. Option D. The order determines the patient's identity. The correct answer is option B. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Bottle order does not verify patient identity. Question 59. For illegal blood alcohol collection, which requirement is especially important in the physician office lab during a final review? Option A. Leave the specimen unlabeled until court. Option B. Let the patient carry the open tube to the lab. Option C. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Option D. Use alcohol swabs for every blood alcohol specimen. The correct answer is option C. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Question 60. Before proceeding with the draw, which action best supports chain of custody for a drug screen specimen in the community health screening event during a study session? Option A. Store the specimen in an unlocked public area. Option B. Discard the seal after collection. Option C. Use only verbal handoff with no signatures. Option D. Document each person who handles the specimen from collection to transfer. The correct answer is option D. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Verbal handoff alone does not create a traceable legal record. Question 61. Why are tamper-evident seals used on forensic or workplace testing specimens in the preoperative testing area during a structured exam prep drill? Option A. They help show whether the specimen was opened or altered after collection. Option B. They make refrigeration unnecessary for all tests. Option C. They prevent the need for a requisition. Option D. They replace patient consent. The correct answer is option A. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. A seal does not replace required consent or authorization. Question 62. For an infant heel stick, which area is safest for puncture in the oncology infusion center during a clinical simulation? Option A. Center of the arch. Option B. Medial or lateral plantar surface of the heel. Option C. Tip of the great toe. Option D. Posterior curvature of the heel. The correct answer is option B. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. The posterior curvature increases risk of bone injury. Question 63. Why should an infant heel puncture not be too deep in the dialysis adjacent clinic during a review? Option A. Depth determines the tube color. Option B. A deep puncture replaces the need for warming. Option C. Excessive depth can injure bone or deeper tissue. Option D. A deeper puncture always prevents hemolysis. The correct answer is option C. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Deeper puncture can increase injury and does not guarantee specimen quality. Question 64. To protect patient safety, which finger is generally preferred for adult capillary puncture in the student skills lab during a mock exam? Option A. Index fingertip in all adults. Option B. Little finger near the bone. Option C. Thumb pad for every test. Option D. Middle or ring finger on the palmar surface near the side of the fingertip. The correct answer is option D. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. The thumb may be more calloused and is not the routine first choice. Question 65. After a finger puncture, why is the first drop of blood commonly wiped away in the occupational health clinic during a skills check? Option A. It may contain tissue fluid or contaminants that can affect the specimen. Option B. It proves the patient is fasting. Option C. It activates the tube vacuum. Option D. It contains only white blood cells. The correct answer is option A. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. The first drop is not composed only of white blood cells. Question 66. How can warming a capillary puncture site help collection in the blood collection station during a practice drill? Option A. It removes the need to identify the patient. Option B. It increases local blood flow when used safely. Option C. It makes every specimen suitable for culture. Option D. It sterilizes the skin completely. The correct answer is option B. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Warming does not sterilize skin. Question 67. Why should excessive squeezing or milking be avoided during capillary collection in the outpatient clinic during a scenario? Option A. It makes EDTA unnecessary. Option B. It prevents clotting in serum tubes. Option C. It can dilute the specimen with tissue fluid and cause hemolysis. Option D. It improves all glucose results. The correct answer is option C. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Glucose results can be affected by poor specimen quality rather than improved. Question 68. When is dermal puncture commonly preferred over venipuncture in the hospital unit during morning rounds during a competency review? Option A. For all coagulation studies regardless of policy. Option B. Whenever patient identification is incomplete. Option C. For every blood culture set. Option D. For some infants, small volume tests, or patients with difficult veins when appropriate. The correct answer is option D. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Blood cultures usually require sterile venipuncture collection and adequate volume. Question 69. A child begins to pull away during a draw. Which action supports safety in the urgent care laboratory during a final review? Option A. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Option B. Scold the child until they stop. Option C. Ask another child to hold the arm. Option D. Continue while the arm is moving. The correct answer is option A. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Continuing while the arm moves increases injury risk. Question 70. In the pediatric clinic, which explanation is best for a young child before a fingerstick? Option A. Use detailed adult medical terminology. Option B. Use simple honest words such as a quick pinch and explain what they can do to help. Option C. Promise a toy only if they do not cry. Option D. Tell the child nothing will happen. The correct answer is option B. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Saying nothing will happen is misleading. Question 71. For an older adult with fragile veins, which technique is most appropriate in the long-term care unit during a structured exam prep drill? Option A. Use the largest needle available. Option B. Leave the tourniquet on for several minutes. Option C. Use gentle anchoring and consider a smaller needle or controlled collection device. Option D. Slap the site hard to make veins appear. The correct answer is option C. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Slapping can injure delicate skin and is unprofessional. Question 72. Why should adhesive bandages be used carefully on some older adults in the mobile collection site during a clinical simulation? Option A. Older adults never need pressure after draws. Option B. Bandages prevent all anticoagulant bleeding. Option C. Adhesive changes the blood type. Option D. Fragile skin can tear when adhesive is removed. The correct answer is option D. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Adhesive has no effect on blood type. Question 73. Before assembling equipment for a basic metabolic panel draw, which item should be checked in the emergency department bay during a review? Option A. Tube type, expiration date, needle safety device, and requisition requirements. Option B. The patient's favorite beverage. Option C. The brand of wall clock in the room. Option D. Only the color of the chair. The correct answer is option A. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Chair color has no role in specimen acceptability. Question 74. When preparing for collection, which sequence is safest after blood has entered the final tube in the physician office lab during a mock exam? Option A. Activate safety device before removing the needle from the arm. Option B. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option C. Remove the needle and recap it before pressure. Option D. Withdraw needle with tourniquet tight and no gauze ready. The correct answer is option B. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Withdrawing with the tourniquet tight can increase bleeding and bruising. Question 75. In a routine phlebotomy scenario, which action should occur before leaving the patient after venipuncture in the community health screening event during a skills check? Option A. Tell the patient to remove the bandage immediately. Option B. Dispose of sharps after walking to another room. Option C. Confirm bleeding has stopped and provide appropriate post-draw instructions. Option D. Leave while blood is still oozing. The correct answer is option C. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Leaving active bleeding unattended is unsafe. Question 76. Why is patient positioning important before venipuncture in the preoperative testing area during a practice drill? Option A. It changes EDTA into citrate. Option B. It allows the needle to be reused safely. Option C. It makes labeling unnecessary. Option D. It reduces the risk of falls or injury if the patient becomes dizzy. The correct answer is option D. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Body position does not change tube additives. Needles are single-use and cannot be reused. Proper positioning does not replace specimen labeling. Question 77. During a scenario, which patient instruction is appropriate after a routine venipuncture in the Oncology Infusion Center during a scenario? Option A. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Option B. Remove the bandage while still bleeding. Option C. Bend the elbow tightly for 10 minutes. Option D. Scratch the site if it feels itchy. The correct answer is option A. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Scratching can disrupt the site and introduce contamination. Question 78. In the dialysis adjacent clinic, which laboratory department commonly performs CBC testing? Option A. Blood bank only. Option B. Hematology. Option C. Histology only. Option D. Microbiology only. The correct answer is option B. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Microbiology focuses on organisms and cultures. Question 79. For a thyroid panel collection, which department usually performs patient and APTT coagulation testing? Option A. Microbiology culture bench only. Option B. Cytology screening only. Option C. Coagulation or hematology coagulation section. Option D. Urinalysis only. The correct answer is option C. Coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Urinalysis focuses on urine specimens. Question 80. To protect patient safety, which department is most associated with blood cultures in the occupational health clinic during a study session? Option A. Histology tissue processing. Option B. Chemistry electrolyte analysis only. Option C. Blood bank compatibility only. Option D. Microbiology. The correct answer is option D. Microbiology. Microbiology processes cultures to detect and identify microorganisms. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Blood bank testing focuses on transfusion compatibility. Question 81. After reviewing the order, which department commonly performs type and screen testing in the blood collection station during a structured exam prep drill? Option A. Blood bank or transfusion services. Option B. Chemistry only. Option C. Parasitology stool testing only. Option D. Microbiology only. The correct answer is option A. Blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Microbiology focuses on infectious organisms. Question 82. When preparing for collection, which department commonly analyzes electrolytes such as sodium and potassium in the outpatient clinic during a clinical simulation? Option A. Blood bank compatibility bench. Option B. Chemistry. Option C. Cytogenetics only. Option D. Histology. The correct answer is option B. Chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Histology focuses on tissues. Question 83. In a routine phlebotomy scenario, which practice is part of phlebotomy quality assurance in the hospital unit during morning rounds during a review? Option A. Changing tube labels after results are reported. Option B. Skipping competency checks for experienced staff. Option C. Tracking specimen errors and using corrective action to prevent recurrence. Option D. Ignoring mislabeled specimens if the patient is well known. The correct answer is option C. Tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Familiarity with a patient does not make a mislabeled specimen acceptable. Question 84. Why are competency assessments important for phlebotomists in the urgent care laboratory during a mock exam? Option A. They allow staff to ignore order of draw. Option B. They are only for patients who complain. Option C. They replace all written procedures. Option D. They verify that staff can perform required skills safely and consistently. The correct answer is option D. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Written procedures are still needed as standards for practice. Question 85. During a skills check, which error should be reported through the facility's quality process? Option A. A specimen collected in the wrong tube type. Option B. A tube is mixed according to instructions. Option C. A needle safety device is activated after use. Option D. A patient correctly states their date of birth. The correct answer is option A. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Correct identity confirmation is expected practice, not an error. Question 86. In the long-term care unit, which activity is commonly associated with CLIA waived point-of-care testing? Option A. Reporting results without controls when controls are required. Option B. Following manufacturer instructions and documenting quality control for a simple approved test. Option C. Using expired test strips because they look normal. Option D. Changing the test procedure to save time. The correct answer is option B. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Modifying the procedure can invalidate the test category and results. Question 87. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the mobile collection site during a scenario? Option A. Skip patient identification because the device stores results. Option B. Apply disinfectant and test before the site dries. Option C. Confirm test strip expiration and run required quality control according to policy. Option D. Use a strip from an unlabeled loose container. The correct answer is option C. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Device storage does not replace identifying the patient. Testing before the site dries can contaminate or dilute the sample. Loose unlabeled strips may be expired or contaminated. Question 88. Why must abnormal point-of-care results be handled according to facility policy in the emergency department bay during a competency review? Option A. Only normal results belong in the medical record. Option B. The patient should interpret the result without staff involvement. Option C. Abnormal results should always be erased. Option D. Critical or unexpected results may require confirmation, documentation, or immediate notification. The correct answer is option D. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Both normal and abnormal results may require documentation. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Erasing abnormal results hides clinically important information. Question 89. After reviewing the order, which blood component is primarily responsible for carrying oxygen? Option A. Hemoglobin inside red blood cells. Option B. Platelet granules only. Option C. Tube separation gel. Option D. Sodium citrate in plasma. The correct answer is option A. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Platelets help hemostasis but do not primarily transport oxygen. Separation gel is part of a tube system, not a blood component. Sodium citrate is a tube additive, not an oxygen carrier. Question 90. When preparing for collection, which blood component is most directly involved in forming the initial platelet plug? Option A. Glucose molecules. Option B. Platelets. Option C. Chloride ions. Option D. Albumin only. The correct answer is option B. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Glucose is an energy source, not a clotting cell fragment. Chloride is an electrolyte and does not form platelet plugs. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Question 91. In a routine phlebotomy scenario, which vessel type is normally used for routine venipuncture? Option A. Lymphatic duct. Option B. Tendon sheath. Option C. Vein. Option D. Artery. The correct answer is option C. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. Lymphatic ducts do not provide venous blood specimens. A tendon sheath is not a blood vessel and must be avoided. Arterial puncture is a different procedure and not routine venipuncture. Question 92. Why is the basilic vein approached with extra caution in the oncology infusion center during a clinical simulation? Option A. It always has a built-in tourniquet. Option B. It cannot be palpated in any patient. Option C. It contains no venous blood. Option D. It lies near nerves and arteries in the antecubital area. The correct answer is option D. It lies near nerves and arteries in the antecubital area. The basilic area has nearby structures that increase the consequence of poor needle placement. No vein has a built-in tourniquet. The vein may be palpable, but caution is still needed because of anatomy. The basilic vein does contain venous blood. Question 93. During a review, which term describes stopping bleeding after vessel injury? Option A. Hemostasis. Option B. Glycolysis. Option C. Hemoconcentration. Option D. Hemolysis. The correct answer is option A. Hemostasis. Hemostasis is the process that stops bleeding through vascular response, platelets, and coagulation. Glycolysis is glucose metabolism by cells. Hemoconcentration is increased concentration of blood components from fluid shifts. Hemolysis is red cell rupture. Question 94. A clotted lavender tube is received for CBC testing. Why is recollection usually needed in the student skills lab during a mock exam? Option A. Clots improve automated CBC accuracy. Option B. Clots trap cells and make cell counts unreliable. Option C. Lavender tubes are supposed to clot before testing. Option D. Clotting proves the patient was fasting. The correct answer is option B. Clots trap cells and make cell counts unreliable. CBC testing requires a well-mixed anticoagulated specimen so cells remain evenly suspended. Clots can block analyzers or distort cell counts. Lavender tubes contain EDTA and should not clot when properly mixed and filled. Fasting status is unrelated to clot formation in an EDTA tube. Question 95. An underfilled light blue tube arrives for patient testing. What is the main concern in the occupational health clinic during a skills check? Option A. The tube will automatically refill in the lab. Option B. The patient's identity becomes verified. Option C. Excess citrate relative to blood may alter coagulation results. Option D. The specimen will become a blood culture. The correct answer is option C. Excess citrate relative to blood may alter coagulation results. Underfilling changes the anticoagulant to blood ratio and can make coagulation results inaccurate. Tubes do not refill after collection. Fill volume has no role in verifying identity. A citrate tube cannot become a blood culture bottle. Question 96. To protect patient safety, which tube should generally be collected before a lavender EDTA tube in venipuncture order? Option A. Another lavender tube for every test. Option B. No tube because EDTA always comes first. Option C. Gray fluoride tube after lavender only. Option D. Green heparin tube. The correct answer is option D. Green heparin tube. In the standard sequence, heparin tubes are collected before EDTA tubes to limit additive carryover effects. Collecting another lavender tube does not answer the order requirement. EDTA does not always come first and can interfere with later tests. Gray tubes generally follow EDTA, not precede it as the key before lavender tube. Question 97. After reviewing the order, which instruction is commonly given for a fasting blood test unless policy says otherwise? Option A. Avoid food and most beverages except water for the required fasting period. Option B. Chew gum with sugar during the fast. Option C. Eat a small snack because it will not matter. Option D. Drink sugary beverages before arrival. The correct answer is option A. Avoid food and most beverages except water for the required fasting period. Fasting helps standardize results for tests affected by recent food intake. Sugared gum can break the fast for some testing instructions. A snack can invalidate fasting status for tests that require it. Sugary beverages can alter glucose and other chemistry results. Question 98. If a timed specimen is collected late, which action is most appropriate in the hospital unit during morning rounds during a competency review? Option A. Discard the requisition without telling anyone. Option B. Document the actual collection time and notify the appropriate person according to policy. Option C. Change the patient's medication schedule independently. Option D. Write the scheduled time on the label anyway. The correct answer is option B. Document the actual collection time and notify the appropriate person according to policy. Actual collection time is necessary to interpret timed results and decide whether recollection is needed. Discarding the order without communication disrupts care. Medication timing decisions are outside routine phlebotomy authority. Writing the scheduled time is inaccurate documentation. Question 99. In a routine phlebotomy scenario, which action increases the chance of blood culture contamination? Option A. Using sterile culture bottles. Option B. Collecting cultures before other tubes. Option C. Repulpating the cleansed site with an unclean glove before needle insertion. Option D, allowing antiseptic to dry. The correct answer is option C. Repalpating the cleansed site with an unclean glove before needle insertion. Touching the disinfected site with an unclean glove can reintroduce skin organisms. Sterile bottles help maintain specimen integrity. Collecting cultures first helps reduce contamination from other tubes. Allowing antiseptic to dry supports effective skin preparation. Question 100. Before proceeding with the draw, which behavior is outside appropriate phlebotomy scope in a routine collection setting? Option A, labeling the specimen at the bedside. Option B, reporting a specimen problem to the supervisor. Option C, verifying patient identity. Option D, interpreting the diagnosis and changing the provider's order independently. The correct answer is option D. Interpreting the diagnosis and changing the provider's order independently. Phlebotomists collect and handle specimens but do not independently diagnose or alter provider orders. Bedside labeling is expected practice. Reporting problems supports patient safety and quality assurance. Identity verification is a core phlebotomy responsibility.